Now, despite returning to pre-pandemic levels, over 1/3 of adults aged 50 to 80 still experience loneliness, and nearly as many feel socially isolated. This is according to a new 6-year study from the University of Michigan. So how do we cope with that, specifically during the holiday season? Joining us right here live on The Splash to give insight into coping with loneliness during the holiday season, owner and licensed clinical psychologist from Viewpoint Psychology and Wellness, Dr. Melanie Schwartz. Thank you for being here, doctor.
Thank you for having me.
We appreciate that. Now, we want to talk about this loneliness and isolation that some people are experiencing. Now, from your experience, I should say, how do you think loneliness and isolation is impacting older adults, specifically within our area of Greater West Bloomfield?
This is not an easy question. This is actually fairly complicated because there's so many factors that play into it. It's not just, there's one answer fits everybody.
Okay.
So really what it comes down to is, number one, time of the year. This is a really rough time of the year for the elderly because of the weather. And, how that affects them because they don't want to go out in the winter. So it's harder for them to go see family, to go visit with friends because they don't want to drive anywhere. Some of them don't even have cars, but, if they look outside and they see that the weather is rough, they don't want to go. Okay, so that's obviously going to contribute to their isolation and their loneliness. Another piece is whether they drive or not. Okay, there's so many people that the older they get, they don't drive, harder for them to get out. Their medical status, where they are physically, and also their emotional health. The piece of this that's complicated is social isolation and loneliness lead to depression, but are also symptoms of depression. So, it's which is what's causing what.
Yeah.
And so that's, a big piece of it. I think the area of West Bloomfield does a decent job because there are a lot of resources. Now, whether people are actually using them or utilizing them is a different story, but there are a significant number of resources for the elderly in this community.
Good to know. Good to know, first and foremost. And I want to explore that a little bit more as we continue to go on. But with that being said, are there any steps or what steps can local healthcare providers take to address some of this social isolation and loneliness that we're dealing with in our area?
Well, I know that the physicians are taking more and more steps. I know, when you go into the doctor's office these days, they'll hand you a form to fill out and it assesses your mental health. It assesses depression, anxiety, assesses your income levels, if you're struggling in any of those areas. So they are taking steps. The problem that I see with doctors is anytime I go to a doctor, I'm, talking to a doctor, they say, I don't have enough therapists or mental health resources to give out to my patients.
Right.
Which that's, I think, more of the problem is that there's not enough mental health availability in the area. And there's a ton. There is a ton, but it's still not enough. I mean, we see it at our practice. Also, another contributing factor is that the older generations are not always open to going to therapy. And unless their family is really going to push them, they're more of the just, I will deal with it. I can deal with it on my own. I'm not, I don't need somebody to help me because that, is just a generational view. So there's that piece too. So having someone who is supportive enough to them to talk them into talking to someone is sometimes difficult too. But I do think that the healthcare system, or at least, your physicians, people's physicians are really doing more than they have in the past too.
Yeah. And to add on to that, I think overall the term mental health has just become more popular within maybe the last 10 years or so.
Yes,
I'll give it maybe 15 or so. But other than that, I can understand why the older generations aren't necessarily in tune with that part of life and not too familiar. But like you said, as the term has become more conscious, we're seeing more resources, more healthcare professionals and providers come out to support that also. So I love that we're all noticing that and seeing that growth, but there's still a little bit more work work to be done.
Yeah.
I do want to touch on, you spoke on programs locally that kind of help that. From your knowledge, are there any local initiatives or organizations within Greater West Bloomfield that you believe effectively combats isolation amongst our older adults?
Yes. Okay. Well, specifically, if somebody is living in independent living or assisted living, right there, they don't have to leave. Wherever they're living, there are plenty of programming all day long.
Right.
Okay. So that's one way. If you are living by yourself, there's Jewish Family Services, which is right on Maple and Drake. There's, the West Bloomfield programming, the Connect. There's the Richardson Center in Commerce Township. There's Ageways, which is in Southfield. And also there's AARP, and they have a line, like a resource line where you can contact them and see what services are out there. So there's plenty, and not including the churches and synagogues and temples, who you can contact as well. So there is a lot of resources, and that's just some of them.
Yeah.
So there's plenty of opportunity. It's just whether somebody is going to make the call to see what's out there.
Yeah, they say you can lead a horse to water, but you can't make them drink. All the resources right there in your face. Are you going to utilize them? With us right here live on The Splash, by the way, owner and licensed clinical psychologist from Viewpoint Psychology and Wellness, Dr. Melanie Schwartz, talking about coping with loneliness and social isolation, specifically during the holidays. I want to talk about the pandemic and how that kind of made an effect, right? How do you feel the pandemic has reshaped our understanding of loneliness and isolation? Even being 4 years removed.
I mean, we still see it every day. I mean, just, if we didn't see it immediately, okay, it was different for the elderly populations because they were more isolated than anybody else. Because, if they were in a nursing home or assisted living or independent living, they couldn't leave their rooms. Okay, so they have way more isolation than the rest of us who were, if you chose to isolate, then you did. But we still see it. Number one, that was traumatic. Okay, trauma doesn't go away just because, it's almost 5 years down the line now. It's still there and they remember it, and it did have an impact. And like I said, we are still seeing the impact in their behaviors, reminders of what things used to be. I mean, I sit here on a regular basis and I'm like, how was that almost 5 years ago?
Yeah.
It seems like it seems very far away, but very close to. And so they're still, everybody, I don't want to say just the elderly, are still, experiencing fallout from that time where they were so isolated and they were helpless and there's nothing that they could do to, they had to rely on family members to bring them everything they needed, or, whatever supports that they had, that they were stuck, and it was very scary. So I think that, that was then. Now, if you're still experiencing isolation and loneliness, it feels the same. It doesn't feel any different. Okay. Even though it is different, there is a little bit more control in it, a little bit more freedom in it. They still feel exactly the same as they did 5 years ago, if there wasn't any type of intervention in the 5 years that have passed.
Good point. Yeah, we're all kind of still shaking it off a little bit for the most part. It affected some people and demographics a little bit more than others, but that's something that we should all still be conscious of. We're still less than a decade removed from that, so we all need to be a little bit more aware. With that being said, don't want to hold you up too much longer, Doctor, but I do want to ask, is there anything that you would recommend individuals or families in West Bloomfield do within our community to help reduce that loneliness and social isolation for older adults in our lives?
I think, people get really busy, and I think it's just being mindful that the elderly do struggle during this time of the year. And, if you are in town, or even if you're not, make sure that your family members are okay. If they're not, the resources are there to help, link them up with the resources to get them into therapy, even if you have to push them, to spend more time with them, to just make sure that they're okay, because this is a struggle for them, especially during this time of the year. Take the holidays out of it. It's difficult, and just be very mindful of how it's affecting everybody in your life.
I would 100% agree. Something as simple as a phone call, a checkup, or something like that, some type of connection could go a long way with helping
Absolutely.
that. Well, we want to thank you again so much for your time and your information. Once again, owner and licensed clinical psychologist for Viewpoint Psychology and Wellness, Dr. Melanie Schwartz. We appreciate you.
Thank you.